Hey girl, hey, welcome back to my channel. If you're new here, my name is Angela Cruz, and you can follow me across all social media platforms at Angela Cruz Tube. You may know me here on YouTube as a beauty blogger, but ever since I became a mom a couple of years ago, I've become more of a mommy blogger. And my son Cameron, when he was just a baby, I think he was only 3 months old, he was treated with surgery at Palm Beach Children's Hospital at St. Mary's Medical Center. It's here in West Palm Beach, Florida, where we live, and it was the most positive experience that you could possibly imagine, giving the concerns as a parent that, hello, your baby's having surgery. I think back on that time and I'm so grateful that I have such a high quality care facility where I live. Right now we're in the midst of a global pandemic and so many parents like me are worried about their children. What do you do if your child gets sick? Do you stay at home? Do you take them to the hospital? There's so many questions, and that's why I'm grateful to Dr. Chad Sanborn from St. Mary's Medical Center for taking the time to speak with me this morning. He's been a practicing physician in Palm Beach County, Florida for more than 10 years, and not only that, he's a father himself. He is a pediatric infectious disease doctor, and he is the perfect person to reassure us and answer our questions. As a disclaimer, I am not a medical professional. I'm merely a concerned mother, and that's why I wanted to speak to the expert. So let's dive straight into the interview. Obviously, right now, a lot of parents might be afraid to take their children to the pediatric ER. What would you say to these parents?
It's a common question we get in the community, and rightfully so. You turn on the TV and you see a lot of scary information, conflicting information out there. So obviously, we typically wouldn't recommend coming to the ER for nothing, right? So if you're thinking that your kid may need medical care, absolutely you should address that concern. So at the Children's Hospital, we are doing some things to make sure you're safe in the emergency department. So there's spacing in between staff. We have patients isolated that could be suspected coronavirus cases. We put them pretty quickly into a room, and with the appropriate PPE, have the staff, doctors, nurses, respiratory therapists address those patients' concerns. And we have rapid testing available when indicated for patients. So if we have a patient that we suspect could have coronavirus infection, we have a way of identifying them relatively quickly to see if they are positive or not. And that may determine if they need to be admitted, where they would go onto the pediatric floors if they were coronavirus positive. So, I would encourage families to, certainly for emergencies, yes, you still need to use the emergency department. And even when, you think your child may not be acutely crashing on you, so to speak, but want to get seen by a doctor straight away, yes, the emergency department still is a good place to be and a safe place to be.
And I'm glad you touched on all the different ways that you guys are keeping people safe and, reassuring parents who may have those understandable concerns, because obviously there are standards that you're upholding and adhering to. And I definitely feel that you're doing the right things to kind of keep parents like me who might be worried reassured about all of that. But if there are any symptoms that you can tell us to look for, like if as a parent, what should I be looking for to make sure, if I'm worried about coronavirus for my child?
Yeah, so certainly, and the good news is that children don't seem to get as severely affected by this virus as older kids do, or adults certainly, right? So smaller children, they can present in many different ways. Common cold type thing, low-grade fever, I wouldn't necessarily be overly concerned, and I wouldn't visit an emergency department just for a fever. The things that would get me concerned with the coronavirus infection, if a child is having difficulty breathing. So breathing too fast or breathing very deeply, that would be a concern. Oh, this child may need some support, some assistance, right? Another concern would be if a small baby in particular, but any child, is not eating or drinking anything. That's always a concern and can be a sign of any infection, but coronavirus being one of them. And then, we have these newer symptoms, I suppose, that we see in response, what we think is in response to a body's coronavirus infection in the past. So these can be kind of varied, but in general, if your kid is having a fever, having red eyes, a rash, a swelling of their hands or feet, or their lips and mouth are becoming very red, that could be a sign that they are having an immune reaction to a previous coronavirus infection that may not have even been detected. because it was mild the first time, and that child may benefit from medications in the hospital setting. So those would be the signs I would say, yeah, you need to bring a kid in. And as I tell all families, all parents, if to you as a parent your child looks sick, by all means you need to bring them to the hospital. I always you got to trust moms and dads intuition with these types of things. They know their child the best, and when they feel their kid's not well, yes, there's some reason why they feel that way.
When it comes to taking your child to the ER, the pediatric ER there where you are, is there an additional procedure at check-in that parents need to be mindful of because of COVID-19 and spacing and social distancing and all those things?
Sure. So we're trying to limit the amount of accompanying family members. So previously with previous ER visits or previous hospital visits, you may have been able to go with all the siblings, dad, mom, grandpa, etc. We're trying to restrict the amount of visitors, even presenting to the emergency department with the patient for reasons of social distancing and trying to protect not only other patients in ER, but the staff as well. In addition, there are going to be screening questions for you upon presentation to the emergency department. So as part of the triage, but also to get an idea, what are the symptoms? In general, the community of people are supposed to be wearing masks anyway, but, we want to ensure that is happening certainly in a hospital environment as well.
That's, of course, to keep us all safe. And I think that's a necessary
yes.
step, especially in a medical facility like that. So how can families best protect their children from getting COVID-19? What precautionary measures can we take to make sure our children are safe from this?
There are some common sense things that sound kind of hokey and maybe not very scientific, but are really important in general for the health of kids. So the same things that your parents told you when you were a child, your family members, etc. Trying to get enough sleep, trying to eat in a relatively healthy way is going to be important. And it's different for each child, each family, but trying to reduce the amounts of stress too. Certainly kids will process stress in different ways. If they see mommy, daddy, uncle, grandpa, whoever, older siblings stressed out by what's going on in the world at the moment, there's a good chance that kid will internalize some of that stress and maybe not do as well as they would otherwise, right? So having time where you can de-stress as a family is going to be important. If a child has an underlying medical condition, you want to try to keep that underlying medical condition well under control. So if it's diabetes, asthma, an immune condition, you want to make sure that they're on the appropriate meds, they have refills of the appropriate meds, they're still in touch with your doctors, your specialists, because, while certain children, particularly with underlying conditions, can be at higher risk from coronavirus infection, we think and get more evidence today of if your condition is under control, you're probably going to do better off than the child whose condition is not under control at the moment. So, some common sense things, some medical things you can do to try to keep you and your family well during these times.
Excellent advice. So I will tell you, and I'm sure other parents feel the same that I do, but every day I wake up and I think about COVID-19 and I play the what if game, with my son, and I think about, oh no, worst case scenario. So I hesitate to say that I would hesitate to take my son to the ER, but you think twice about these things. How can you reassure us? How can I feel good about, if my son has, God forbid, an accident or something, he needs to go to the pediatric ER. How can I get over this fear? What advice do you have for me and for other parents who may think along these same lines?
So you do see that numbers, unfortunately, are rising at the moment or very high levels here in South Florida. So that is a concern in general. However, in the hospital, we're trying to keep it as safe as environment as possible because we know, especially in the pediatric world, most of the children who present are not going to be coronavirus positive. Again, kids don't get quite as sick with this and don't get quite sick maybe as frequently as some of their adult counterparts will that require hospitalization. So, the coronavirus patients, we try to identify them as quickly as possible, or the people at risk or under investigation for coronavirus. Try to put them in isolation rooms as well. So, we can provide care for them in a safe environment without them exposing other individuals who may not have coronavirus as well. We have PPE available for the staff. So, it's not that the same care providers are going to be using the same equipment on every child, regardless of their diagnosis. And, in general, we're trying to do things as per CDC and what our state health department officials tell us. So sometimes that information changes from time to time. We have to kind of adjust on the fly, but there is constant education for the nurses, for the doctors, for the teams on the floors to be able to be informed and be updated about what's going on, not only in the hospital, but also what's going on in the world and what's going on in hospitals in general, to be able to provide safe care for the patients that we have there.
Now, everybody knows this, and maybe you don't know this, but I'm a huge fan of St. Mary's Medical Center. I think it is the best of the best. And for those people who are watching this video that may never have gone there before, or they're not even familiar with the hospital, what would you say to them to say this is the place where they would want to take their child? If the child, again, God forbid, is sick, why is St. Mary's, why is your facility the best one? Because I know, but tell them so they know.
Sure. So, it's a great place. I mean, obviously, we don't want to see many sick children in the community, but there are emergencies that occur and there are illnesses, underlying problems that do happen. I think St. Mary's in the county of Palm Beach is one of the places and maybe the best equipped place to handle these sick children, in my opinion, right? So we have pediatric specialists, we have a neonatal intensive care unit, which is quite busy at times. We have a pediatric intensive care unit, hematology, oncology services, do some wonderful things with orthopedic surgery. Some of that gets frazzled and maybe not quite as organized as it was previously. When you have a pandemic, everybody's focused on one thing, but there still are a lot of great things that go on there. And what I see is the nurses, the doctors, the respiratory therapists, physical therapists, occupational therapists, all of them are specially trained and for the most part, really enjoy working with children. So I think that also is something that kind of sets us apart from many other places. So, your child may be sick. It may be a stressful experience, as most hospitalizations seem to be. We do our best to try to understand those concerns and provide care, not just from a great medical standpoint, but also taking the family's concerns into account as well. And our most important people we deal with is the children we're trying to help out, right? So there's child life programs. We try to do things in a way that keeps the kids maybe less stressed regarding what's going on as best we can. So, I think it's a really dedicated team of people that work over there trying to keep our community healthy.
It's a genuinely impressive facility. Is there anything I haven't asked you that you think people need to know?
Yeah, I think as far as coronavirus goes, we do see children, unfortunately, that do have coronavirus infection that require hospitalization. But I don't want people to panic. The great majority of children in Palm Beach County, but not only Palm Beach, but all of Florida and the world, the great majority of children are not going to get very ill from this virus, which is great. But when you do, you want to be able to be in a place where you can get cared for in an appropriate manner should that happen. So, I want people to take responsibility in their own families and themselves, monitoring health, monitoring mental health for the family members in these stressful times, taking part of the responsibility for being part of a community, right? We don't have, unfortunately, a lot of great tools in our toolbox to be able to treat a patient in a pandemic like this, meaning there's not some magic drug that makes you better. We don't have a vaccine yet. So having some personal responsibility, wearing a mask, social distancing, trying to stay away from other people when you're sick, trying not to send your kids to be around other people when they're sick as well. These are all important things that sometimes get lost, but things that, we can control what happens to our neighbor. We can control what happens in our community. So I think if we all work together for this, certainly things should and will go better, right? And at St. Mary's, we don't like having to have lots of patients that are sick, but we are always prepared for that and certainly try to provide the best care in all situations, all conditions for these children.
Again, as someone who has been there with my child that was sick, I'm a firsthand testimonial about the quality of care that you guys provide. So thank you for everything you're doing, and thank you for sharing your thoughts with me about the current situation that we're facing. Thank you so much to Dr. Sanborn for speaking with me today, and especially for setting my mind at ease on a couple of points. We are in such tough times, it's hard to feel reassured as a parent, but I do feel a little bit better now that I've spoken with him. Thank you to St. Mary's Medical Center for partnering with me on this video. If you have any questions about the hospital, I will have linked in the description box below their website. As always, thank you so much for watching. Be sure to hit that subscribe button so you don't miss any future videos that I have coming out. Meantime, thanks for watching this video. I love you so much, and I'll see you in the next one. Bye.